Howdy everyone, Matt here. I got a question for you. Do you believe there should be business classes in PT school, or is that just a waste of time? Let's talk about that. But first and foremost, let me introduce myself. My name is Matt. I'm Matt the PT, and I'm coming at you with another video on another topic of something in the physical therapy world. So recently there was a discussion and people were saying they need to add business courses to the PT program. Take out this other stuff and put these business courses in there. Well, there was a discussion with people giving all sorts of opinions, and I thought I would share mine, and I want to talk about it. And of course, by all means, I want to hear your thoughts, opinions, beliefs, all of that. So I will give you a little background about myself. One, I have an undergraduate in business, so I have that education there. I've also run clinics for several different companies. I've had my own clinic. So I do understand some of the business aspect of physical therapy. Now, first thing I want to lead off with. Several years ago, it started, and I've just heard this over time, that people have wanted to add more to the physical therapy programs, mainly because we as physical therapists are in a very good position to help many people, and that we just want to provide better care. So part of the coursework was things to prepare us to be, a primary care or a first line provider. I think that's great because I do see that there are more people out there in the community that are recognizing us as physical therapists as somebody to come to. I mean, I work in orthopedics, so if somebody sprains their ankle or tweaks their back, it makes sense to come straight to a PT and say, hey, can you assess this? Rather than going to your primary care, because it could be several days before you get to go see them. They just may just give you medication and you got to come back. So it's just a long process. So, we have this very, very good position to be a, frontline provider. Likewise for neurologic disorders or pediatric, disorders, in any of those things. There's also talk about wellness, helping people manage chronic disorders. So people with high blood pressure or diabetes, that who better than a physical therapist to help them with managing that disorder or eating, teaching them to eat better and to exercise and sleep. And so to have more of that understanding to work with this population of people. And also about psychological issues. Now, I'm not saying to be like a psychiatrist or mental health guy. I'm not saying things like that, but being better equipped to recognize issues of mental distress, mental disorders, like depression, that we can see and understand when somebody is dealing with depression, and that maybe we can direct them to the proper avenue of care, or working with a psychiatrist, with somebody with a mental health disorder, which exercise has been proven to help some of these conditions, and being able to understand that, or understand what somebody is going through. And, with things like, again, somebody's coming in with back pain, and why are they having back pain? It may be that they're overweight and it's causing some back pain, but why are they overweight? Well, they're overweight because the back pain stops them from moving, so I can't exercise as much, and they've gained weight, and maybe they're stressed and they're eating from that, and they're also dealing with possibly not working, and then they could possibly lose their home, and just dealing with relationship issues. It could be a whole lot. And just seeing that we as a therapist can recognize when somebody is going through this disorder, through these issues or a disorder, and that provide optimal care for them. And they were saying we need to add this coursework into physical therapy programs. But on the flip side of that, people were saying we need to look at trying to take some away from programs, because with the cost of school, we all know that PT school, or just grad school in general, is pretty expensive. And they say, if we could cut it down from 8 semesters down to 6, that will save students money, because you're not paying for those extra semesters, but also gets them into the workforce sooner, which is what you want to do. You want to get people through school and out there working. So I'm like, well, you want them to do more, but on the flip side, you want to take away more, so I've seen that. Now, with that being said, recently people were talking about putting these business courses into PT programs, and that was the thing. What are we going to do? We have to take away some because we don't want to make it longer. And people are saying, like, yeah, we could take away courses like modalities. Do you really need to know all of those modalities, like heat and ice and traction and ultrasound and E-stim? Do you need to really know all those stuff? Because evidence shows that it's not very beneficial. Well, I would say that I just had this discussion with somebody that I would say having that coursework is beneficial because if we think about it from the patient's perspective, what are they going through? What are they thinking is best for them? Are they thinking like, I need to ice it. I need to do the traction on my neck or my back. I need that shocky thing. And we as therapists can educate them about what it does and what it doesn't do and how it may help them and how it probably won't help them, because there are other people out there who are very willing to give them those passive things just to keep them in this cycle of keeping them coming back, because isn't a part of what we do education, that we should be educating our patients. So I do see like some of those courses can be beneficial to educate therapists, that we can therefore educate our patients. And I think a really big thing that we need to ask about these business classes and this coursework is who's going to teach it. That's been the biggest thing that people have talked about. Well, who is going to teach it? Do you want the academics to teach it, the people who are teaching in the PT program? Well, the issue that people could bring up is that, well, they're academics. They don't run clinics. They're just teaching it out of a book. That's not the real world experience. I completely understand that. But who are you going to get to teach that? Who is a business person? I will say, if you are running clinics in any kind of capacity, you're pretty busy. You are pretty busy. So are you going to be able to find somebody who can donate enough time every week to teach this material, along with giving examinations and grading it? Are they able to give that time? And if you happen to have somebody who's doing that, who would you want? Would you want somebody who is a business owner of 30 years? This person started their clinic in the 90s, and they can tell you about all the changes in healthcare and the economic changes that have went on. So their struggles and how they built this thing up and became a pillar in the community. And that could be really valuable to see. Like, yes, this person has run this clinic for a long time and they've done that. But I would say a knock on that is that person started back when, again, healthcare is not the same as it is now. So they were in a different climate. Likewise, when they went to school, it was much less to go to school. So they came out with less debt. So it was easier for them to start a clinic because they didn't carry as much debt, so they could get loans and things like that. So, also they may be in an area where they're the only one. They were the only one who was there. So they established themselves very quickly and they just became very, very known. Now flip that to maybe having somebody come in who's been practicing just 5 years. They've owned their clinic for just 5 years. And this person, hey, I've started this clinic at a more, close time to the same economic climate that it is currently. So I can tell you what I went through to start this off now, what my patients are dealing with and the struggles and things. Of course, dealing with competition, or maybe like they added virtual, you have that. But you do lose the experience of it, of the up and down. So like what happens if they started their clinic in an economic boom when everything is really, really good? What's going to happen if they're teaching the stuff then and an economic recession happens? How do they navigate that? And how can you teach that over to someone else? Also, I would say how the clinic is set up. Do you want somebody who is just cash pay? Someone who's coming in and teaching this course that they just run a cash pay clinic, whereas, that could be compared against somebody who runs a clinic that just sees all, insurance, or a combination. How are you going to do that? Or maybe you bring in somebody who is a director or a regional manager or a regional VP of a larger company. So they could tell you about the business side of it from these massive corporations that, not massive, but big PT corporations. And again, all those viewpoints are going to be so different between each one of them. So who is really going to be the best? I mean, and also, are they going to provide it with the most accurate information as well? Are they going to be able to, tell how the struggles were? Because I've known people that have started clinics that had a very large windfall or settlement. So they came into opening a clinic with a whole lot of money. And so that they had a large, inheritance from somebody. So that was able to get them a prime location. They were able to carry themselves and pay their bills while they're building up the clinic and put more into their marketing. Or I know of other people that just came from a very well-known healthcare family that their name was plastered all over all the healthcare buildings around town. So they opened a PT clinic and just used the same name, and boom, I can go to them because they got the same name as everyone else around here. Or, maybe this person started off the clinic and again, had a little bit better situation. Then they had a spouse that had a very good job that was, paid very well. They had insurance, so they had this nice safety net. So they could take a lot more risk versus somebody that said, hey, I just did this off a shoestring budget and I just built it up with my two bare hands and I'm just there. So I could see that there's so much. It's really hard to standardize that, to standardize who is going to teach this information. And the things I kind of want to close with is this. Again, with teaching this material, is it worth adding something else into the program that's not based in patient care? Because very often these people that are coming out, we want them to start working with patients. Give them the information to help people, to treat patients, to make sure that they're safe, to provide the best care possible. And it's throwing in business classes that's not related to patient care. Is that good to do? Is that worth their time? I mean, you may say, they want to start a clinic, but how many are going to start a clinic within the first couple of years after school? Really, some of them may say, I don't plan on ever starting a clinic because I'll say with starting a business, I've known buddies that have done that. And they said, I went from working 40 hours for the man to working 100 hours for myself. Some people don't want that. What about the time that they decide to start their clinic? It may be 5 years out of school and they taught that course, in their first year. So, possibly 6, 7 years since they learned that information. Information could be long since outdated. And I don't remember anything from the first year of PT school. They were teaching me in that class and they have to go through this. They're like, I spent money to learn this stuff, but it doesn't even apply because I don't remember it. And I can't go, I don't have the time to go through all of this. So, it's an interesting thing. It's an interesting thing. And of course, I want to hear what you have to say about this. What do you think? Do you think business coursework should be in PT programs? Should it be its own class? Should it be about running a clinic? Should it be about starting your own clinic? Should it just be the aspects of just what you're billing and what you're doing to understand this is what you're billing out. This is what you're getting in. This is how you document. This is how you do those things. This is how you read a paycheck. This is how you understand taxes. Do you think that needs to be a part of the program? And where at do you think in the program? In the beginning? Maybe closer to the end, because I can see as it's closer to the end, it's going to be much more relatable on there. So let me say thank you so much for taking time out of your day to watch the video. If you enjoyed the video, hit the like button. Of course, consider subscribing to the channel. It doesn't cost you a copay or anything like that. And like always, take care of yourself. Take care of your patients. I'll see you next time.